right, everyone, welcome to the Job Box. I'm Casey Sosa, your host. Let me just give a quick intro to what this podcast even is. Most of us, right when we graduate high school, have no idea what jobs are out there. I know I didn't. You might not even know that your dream job exists. Like the job that I have now, I didn't even know it was a thing until I went to college. It turns out that my career, I technically didn't even need a college degree, just a great portfolio. Although I love my college experience, I met my network of friends and mentors. I didn't know the options out there, which is why I made this podcast as a resource for people entering the job market to explore their careers before they even decide what's next.
Yeah, because your path really starts early in your life and you just don't know it yet. Knowing what you want to do or what's possible and what gets you on the right path as early as high school, that level of foresight is helpful.
Yeah, absolutely. It would just be so helpful for so many people to have an idea of what they want to do, what's going to bring their life the most fulfillment early on.
Exactly. And I think what I would have done had I had a podcast like this early on, like in high school, is I would have done a lot more job shadowing. Whereas as a high school student, I was not even thinking about that.
Well, let me give you a quick introduction. You wrote one down. I added a few things to it.
I love it. Amazing.
Okay, so Forrest here. He was one of my very first roommates in college, and we've been in touch ever since. We became such close friends. He's the oldest of 6 kids. He grew up in San Diego, California. He left for college at age 17 and pursued a degree in neuroscience with a minor in African studies. Is it African or Africana?
Yeah, it's Africana. So everything Africa and the diaspora.
Okay. So with a minor in Africana studies, he served a mission for the Church of Jesus Christ of Latter-day Saints in Mozambique, Africa. And did you decide to minor in Africana studies after or before that?
Yeah, that's a good question. That idea came afterward. I had some time in my schedule and I loved it so much.
Really cool. And then when you came home, you met your wife, Olivia. I was there for the whole dating experience,
Yeah, I saw it all.
And then now you guys have 3 kids.
That's right.
Wow. Wild.
It's been great.
When you were a sophomore in college, you decided to go to med school.
Yep. I'm at the University of Utah, and it's a 7-year training program. This is my 4th year. And yeah, it's been a great experience. This year is like a research year for me, where we focus on building sort of a research portfolio in the middle of our residency. It's an important part of being a well-rounded neurosurgeon. It's a total of 7 years. And, the first year is mostly learning how to do clinical things, which is like take care of patients in the hospital and take consults, which are when an emergency comes in or someone has a new problem with the brain or the spine, they'll call us. And then I have to go meet the patient, find out what's wrong, and find out the next step in the treatment plan. And so that's like the first year. And then after that, you start to learn how to do the surgeries for the rest of your residency.
So I think a lot of people know that the medical field is full of all kinds of careers. I mean, everyone knows that a neurosurgeon operates on the brain, but give me some context. What does that entail?
Yeah, that's a good question. And maybe one way to think about neurosurgery is to think about it in its subspecialties, like the components of neurosurgery that you can go into to specialize even more. So number one, neurosurgeons can specialize in the spine. So some people have abnormal curvature of the spine, or they have fractures of the spine or disc degeneration. Many things can happen with the spine. So spine surgeons focus on fixing those problems, either removing compression of the spine, removing spinal cord tumors, or correcting the alignment of the spine. And then you can specialize in vascular neurosurgery in the brain and even in the spine. I guess you can have abnormal vasculature, like arteries and veins. They can connect too early, or an aneurysm can arise in a patient, and those can rupture and cause a big problem. And so you can specialize in the treatment of the blood vessels of the brain and spine. And you can specialize in treatments of brain tumors. And so those are kind of the areas you can specialize within neurosurgery. And broadly, it's like tumors, disorders of fluid on the brain, disorders of vasculature like aneurysms, the spine. Those are kind of the broad categories. And there's a kind of an evolving field that's been around for decades, but it's gaining more and more traction, is functional neurosurgery, where we're modulating the function of the brain. So by sticking in a small electrode in the brain as one example, and then stimulating it, you might be able to treat someone's tremor in their hand. So that's one way to just
Wow.
understand neurosurgery in a nutshell.
Well, I'm sure each subcategory has its own trainings, like its own unique
Yeah.
specialized trainings and courses that you need to complete. Which of these subcategories are you specializing in? Do you know?
Man, it's been hard because at any point in time, I've loved every single one of them and have considered joining every single one of them. So it's one extra year on top of your 7 years of training to subspecialize. So pediatric neurosurgery is one that I considered. I considered a vascular neurosurgery as well. I mean, there's nothing that I didn't consider, but I've settled on specializing in complex spine. I think that's the greatest need overall in neurosurgery in America. And so by subspecializing into that field, you're meeting a big need in your community and you're more marketable. You know, you can go pretty much anywhere in the country. You're not tied down to having a big center. So I'm just trying to specialize in spine for a multitude of reasons. I love it, but also it's going to make me more marketable. It's going to help me get a job in a place that I like.
That's awesome. Now that we kind of have a little bit of depth into like what you do, let's dive in a little deeper. This section I'm calling the good, the bad, and the break room, where we go into the best, the worst, and the culture in general of it. So you know what? Let's come out of the gate with the best parts about the job.
Yeah. Oh, that's so easy. I absolutely love my job, and I love it basically every single day. And the best part of it, I think, is I like the feeling of being stretched physically, mentally, emotionally at my work. And so that part I love. The fact that it's a challenge, I guess I could say, in other words, it's a challenge physically, mentally, and spiritually, and emotionally. So I love that part of it, but I love being able to work with my hands and make a difference in someone's life that I can see right there in front of me. Like all the training that I've gone through, the years of schooling and the debt that I went into, it's all so that I can use my hands to hopefully make someone better or halt the progression of a disease or slow down the progression of a disease. And seeing the results of my work firsthand after using my hands to do it is so rewarding. It's an incredible feeling.
That's great. Yeah. Do you feel like most of the neurosurgeons that you've met kind of share that same love of the work?
Yeah, I'd say most people do love the work, and I think it's not a stagnant thing. But everybody at some point goes through peaks and valleys, just like everybody does in life on every subject. As humans, we oscillate. You go up and down, and hopefully, it's in an upward trajectory overall. But I know that almost all of them come out the other side feeling good again. So I would say most people love the work, but every single person has hit at least one valley in their career.
Would you say that that is the worst part of the job then, is like the long hours, the just the high demands of it?
Yeah, on one hand, I like the demand. When I'm called in the middle of the night to come to a patient's bedside or come to an emergency, I know that they actually need me. You know, for me, it's like it's cool to hear this is a life or death thing. I feel no anger or angst when I'm called in the middle of the night to go help someone who's in dire need. So that's a great part of it. The hardest part is when those things stack up back to back to back, in addition to witnessing human suffering, because neurosurgical pathologies or problems with the brain and spine are some of the worst that humans experience. And so having to witness that day after day over and over again, in addition to those other difficult parts of the job, that can really take a toll on you. But that's why people have good coping mechanisms, and those who deal with it healthfully or have intermittent breaks and can recharge during that time, they don't burn out, right? I think the burnout rate is maybe lower for neurosurgeons than some other surgical specialties, but it depends on what report you look at and who you talk to.
So how often are you getting called in the middle of the night usually? Like, and is that like pretty
Mhm.
average for a neurosurgeon?
Yeah. So I'm at an academic hospital, and so that'll be different than someone who's in a private practice. During my fourth year, I do 24-hour shifts around once or twice per month. And on those 24-hour shifts, I'm called, I would say, every 30 minutes or more to help somebody. And that could be just like, oh, this person's in a lot of pain after their spine surgery yesterday, and they need some extra pain medications. But I would say overnight, going to an emergency where truly, like, it could be a life or death, or could be, you know, a very dangerous situation. I would say it's probably between 1 and 5 times per night. So it's a big range, but it keeps you awake, and that's okay.
Oh
That's
yeah.
when I'm there on a 24-hour shift, that's what I'm expecting.
Which leads me to the cultural impact of that. obviously everyone has a personal life outside of work. So how does your job like kind of impact your personal life, your work-life
Yeah.
balance? What's the work-life balance like?
I've had to come to grips with what a work-life balance is. It's not a balance of how much time I spend between my work and my family. No, that's never going to be balanced. I spend a lot of time at work, but it's a balance of quality, right? I give everything I have to my work when I'm there, and then I give everything I have to my family when I'm home with them. And to be honest, I think that my family just they must be resilient. I'm away from the family a lot, but we feel like we have a very good balance. And the way that it affects my family is kind of the question you really asked, is I really have had to leave things at work. I could see, the most terrible accident, like someone fell and broke their back doing some extreme sport or got in a car accident or, and sometimes it's like, wow, she's my wife's age or, oh, this kid, he's my daughter's age. And those type of things, you really have to have a very good separation because if you let it get to you, it'll make you a shell of a person when you're way around your family. And they've had to deal with not being around as often. And so choosing a career based on who your spouse is also extremely important. Is your spouse okay with you being gone during these hours? Are they going to need you home during these hours? Are you going to be able to take calls in the middle of dinner? That's kind of a summary of like the things that come to top of my mind is quality and separating work and family.
Yeah, that I think that's a really great point. I can think of so many times when it's been difficult to separate that, especially like, I've had a tough day at the office and
Mm-hmm.
sometimes it can be difficult to just separate that mindset.
Oh, absolutely.
It takes a lot of practice.
It does. It really does. Sometimes you're carrying baggage with you from work.
Kind of coming back around to the job, I
Uh-huh.
think, at least in my experience, a lot of employers aren't always like forthcoming about salaries.
Yeah.
So like let's get into this section now. I'm calling this section the bacon.
Yeah.
And let's talk about it. Like what is entry level pay like versus experienced pay in your
Yeah,
industry?
there's like a divide in the field between academic neurosurgeons, which are those who work at like a university hospital. They make less money on average. And I think it's because, in a teaching hospital, they're not just like cranking out as many like elective surgeries, meaning surgeries that are just like scheduled on a more like convenient basis. They're dealing with emergencies. They're dealing with patients without insurance. And so the compensation mechanism is different. So I would say that it varies across the region, across the US, but I would say on average, I would say the starting salary of an academic neurosurgeon is probably around $500,000. And it's lower in some places, it's higher in some places. And then an academic or a non academic surgeon, so one who's working in the community, a lot of times you can sort of like negotiate your salary to be almost whatever you want within reason, within like a range of like maybe 400,000 for the first couple of years as you're getting your feet under you.
Just real quick, what is within reason though? Like I have no like
Yeah.
idea about what even that range could be like.
What I've seen, and I'm maybe not the best source. I've seen a lot, but I haven't been in the negotiating process myself yet.
Mhm.
But it's between 700,000 to 1.2 million, I would say, is what I've seen. And the reason why there's a little bit of a range there is because when you're first starting out, you're going to be slower. You're going to be because you have to be really cautious. You've rarely done these things on your own. You've definitely done plenty of surgeries on your own with a surgeon watching you and doing everything with you when you exit the residency. But when you're establishing yourself, it just makes sense that you're going to be a little bit slower.
Totally.
And so you're not going to be as productive producing as much like revenue for the hospital. And so if you say, okay, I'm going to start with a salary of 700,000, but if you only do $600,000 worth of surgery, for the hospital, then I guess you're sort of in a deficit, but they're still going to pay you that because they know you're going to catch up. And once you've caught up, sometimes they'll pay you on top of whatever you say, okay, I made $700,000 worth of surgeries by this month. And for the rest of these months of the year, you're making a little bit more on top of that. So that's often how it goes. For your first couple years. If you're going to change jobs, you can say like, well, I know how fast I operate and how quickly I can sort through patients in clinic, whether they do need surgery, they don't need surgery. So you're just more efficient and you're more skilled and you're safer while doing it. And the patient is not asleep under the effects of anesthesia drugs for as long. So all of that adds up to being able to make more money as you go along. But some people trade, I don't want to be exponentially more busy. I want to hit a certain point and then live a better life, like, have a better outside life. So
Yeah.
that's the range.
Were you saying that 700 to 1.2 is that like the experienced level, or like is that the starting pay?
Yeah, I would say between 7 and 800 is common for a starting salary. Some places will get aggressive and say like, well, if you think you'll eventually be as busy or busy enough to make $1 million this year or in the first couple of years, then we can compensate you for that. But if you're not going to catch up, then we're going to let you go. Like we can't just subsidize your salary. So, and I'm probably not explaining it perfectly, but that is the range. That is the range. And if you go to a rural
Gotcha.
place like North Dakota, they'll often pay you a little bit higher because the demand is way higher.
Okay, that's interesting. Yeah, I didn't know that. So is it pretty common that like people can negotiate salaries, or is it like
Mm.
you apply to a job, you get the job, and they're like, okay, this is our budget, so this is what you're getting.
That's a really good question, actually. I think it's hard to negotiate, and because you're at their whim, right? So you don't have that much bargaining power. But if you get an offer from somewhere, but you'd rather work here, you can say, "Look, they're offering me this over there, and it's enough for me to move there. But I'd prefer to work at your hospital. Can you sweeten the deal?" So that's kind of where you can negotiate, and no one ever signs until they know what the compensation is. And the compensation is you can have a salary or you can have it be driven by like every time that you do this surgery, you get this many RVUs, which is like a value unit. It doesn't really matter. So let's say a neck surgery is like worth 10 RVUs, and you can negotiate and say like, okay, well, I want like $80 per RVU. And they're like, well, we don't pay more than 75 per RVU. So that you can negotiate salary or like per surgery, how much you want to be paid, or how much call you want. Like, I'm going to be on call 4 days a month, and it's this many dollars per time I get in it. Those are the three layers, I think.
Gotcha. That's okay to know. As we were talking, a few weeks ago, it sounds like there's quite a bit of people that are going through med school to become a neurosurgeon, but like, how is the job security overall?
Yeah, I would say it's a very secure job. It's one of those things that the field is advancing, the needs are increasing, the population is increasing, and the number of neurosurgeons has is not exponentially growing. The field is not becoming saturated. It's really, really regulated who gets to be a neurosurgeon just based on like how many spots for training are available. And that's not going to change anytime soon. The people in charge of that are never going to create a surplus of neurosurgeons. There's no way. So there's going to be demand, and it's very stable. And I feel lucky that that's the case. I know that AI is changing a lot of jobs. It's not really. I think that there's a lot more fear about AI than there really needs to be in a lot of jobs. But for neurosurgery, I think it's stable because it's sort of like you're a trained professional, and that's one of the things I liked about it as well. I didn't foresee that being a major factor when I was in high school or when I was in college, but it turns out that it's nice.
How is AI changing the neurosurgery industry?
I think we've yet to see everything that could come from this, but there's certain AI tools out there that'll help you. It's trained on like prior neurosurgical like videos and procedural research that's been done. And that training model has been able to be applied to an AI model that'll help surgeons plan their surgeries. So that's kind of cool. I haven't used that tool yet, but I'm sure I will by the time that I'm out and maybe even before that. So that's one way. Another thing is there's something called open evidence. It's an AI that's trained just on research out there. And so I can, if I'm about to make a clinical decision where I'm saying, okay, this patient is having an abnormal heart rhythm in the ICU. They just had a craniotomy. They were previously on blood thinners for this, and now they have this issue. I'm thinking about treating the patient with this medication. Is this safe or is this right? And it will look through the literature for me and find and say, yes, that's the right medication. I would actually increase the dose a little bit than what you had planned because your dosing is based for an individual who's smaller than this, And that has been life changing. When I'm in charge of the ICU as the resident, I mean, there's always someone like above me, but when I'm the first pass at making a decision on a patient, I'm able to use that to make intelligent decisions or at least back up with evidence my thought processes. That's been the life changing. So those are the two ways that I know. And then the third one is one of the biggest challenges of medicine in general, maybe not as much in neurosurgery, but is a very still is a big challenge in neurosurgery, is you have to take care of all these patients and do the clinical work and see the patients in clinic to see if they need surgery or not. And then that's all fine. We love that part. Interacting with people, like, you have to. Otherwise, you don't go into this field. Well, I guess you could go into like radiology where they're just looking at images of patients but never actually talking to them. But if you're in the clinic talking with patients, the worst part is you have to write everything down that you've done. And that often gets pushed to the end of the day. So you're like, okay, I'm done at 5. It was a great day. And then you're writing notes for 3 hours at home when you should be with your family. And AI is actually, I haven't used it yet, but I've seen doctors use it firsthand where they have an AI listening to the conversation and it's all protected information. It's not going any cloud-based services that doesn't handle information well. It'll turn your encounter that they've listened to into a note for you. That is going to be life changing. Now, the hard part is I think that for some people, like emergency medicine doctors, what the hospital is going to do is they're going to say, oh, well, now you can see more patients in the same amount of time. And then the burden just increases to fill that gap of what AI was supposed to make it easier. So those are the 3 areas: surgical planning, clinical decision making, and then note writing, which I think is going to be awesome. All 3 of those things I'm excited about.
That's really really cool that even is an option for you. Do you do you ever like get concerned that there could be, like you talked about the clinical decision making, that like the AI
Mhm.
could be wrong when it
Yeah,
gives you this information back? At
that's
least that's,
very,
because that's what I've
very
seen
true.
in like my own, experience with AI, and
Yeah.
I'm using it all the time, asking it
Hmm.
questions, or like I tell it to search something for me, and or like, I'm looking up a tutorial for something,
Hmm.
and it's wrong. It's completely wrong, and it just kind of doubles down on like, oh no, this is right.
Yeah, that's dangerous. There are definitely AI models that you should not, actually, most AI models you should not be using for medicine. But the ones, with open evidence, the nice thing is that after every claim that it makes, it cites a paper. And you can look at the primary literature written by humans to make sure that it's correct. And so that makes me feel a lot more comfortable. And then also, I went to medical school. And so if something sounds incorrect, I will push back. And mostly the things that I've pushed back on with the AI have been things like, this patient could be having this really severe reaction because it's trying to like, cover itself. It's trying to not get sued or something like that. So it's like this person could be having this massive heart attack or something like that. And really, I see the patient right in front of me and I'm like, okay, no, okay. Yes, I understand that what I told you might be scary, but I see the patient right here. I can see the results, know that they're not having a heart attack, like just clinically. So please get to the point. Like, please get to what I was actually asking you, and don't try to stop and like cover yourself from getting sued. And that could be good. Like there could be another scenario where it says like, oh, they're having a heart attack, and I was like, oh, I wasn't even thinking down that pathway. Which for a heart attack, I mean, that should never happen. You should be able to pick that up.
Sure.
But just maybe a better example is something more mild. So that's where I think you can only trust certain models. Like there's certain models of ChatGPT and certain models of Claude and things like that. You should never ask it a medical question. It will give you wrong answers with high confidence.
Yeah, for sure. And yeah, then that makes sense. Like no matter what, using AI, always got to use your common sense too.
Yeah.
Stuff. So
Don't throw it
your
out the
own
window.
training, right?
Yeah, exactly. Your own training coupled with AI can be a powerful tool, but I wouldn't send, like a non-medical person in there with just AI to do everything. It'd probably
Right.
get a lot of things right, but where it failed would be bad, would be really bad.
Yeah, I don't want to be doing any surgeries for you anyway.
Yeah, yeah, exactly.
Well, you mentioned that like there are planning that goes into each surgery, and it makes sense that there would be a plan for a surgery. I haven't seen that side of things. All I've seen is like,
Yeah.
someone goes in for a surgery and they're given the surgery, and from the outside looking in, I'm like, "Oh, it's just like the same surgery every time, like
Mm.
someone has this going on, so they give them this surgery." And but
Yeah.
how long does like a plan take?
Yeah, there's some surgeries that take weeks of planning and multiple experts because it's just that complex. But I would say on average, let's just imagine that there's a brain tumor sort of at the top of the head here. I will spend 30 minutes to an hour, just looking at the patient and their symptoms. Because if it's like, oh, the patient is weak on one side of the body, immediately I'm like, shoot, this brain tumor is affecting the motor control of the body. That means that the surgery is for sure going to be treacherous. And that means, and I have to plan what I'm going to talk to the patient about too. If when I talk to them, I'm going to say, look, you've already had some weakness on this side of the body based on where your tumor is. Maybe it's not right on the motor component of the brain. Or the motor control, the movement control of the brain, but maybe it's nearby. I'm going to say, look, it's very likely that after surgery, your brain could be stunned for a little while and you're going to be temporarily weak. And there's always a chance that you could be permanent. So it just changes what I say to them. So I have to plan out what to say and I have to plan what approach to get. So there's, if I'm triangulated here and here and at the center of my two fingers in the brain, there's a tumor there, and depending on the size and if it's pushing away the optic nerves or if it's pushing away other nerves in the brain, you could consider, okay, we could do an incision like this. And the downside is you might have to dodge the nerves that control your vision, and that's really dangerous. But the patient wants to get pregnant one day, and we could go through the nose. But if we go through the nose, we might have to injure the pituitary gland. And the pituitary gland helps control the hormones in the body, which are important for getting pregnant, right? And so in that regard, you're like thinking for 30 minutes to an hour about like, okay, let's balance out the priorities here. Vision is more important than getting pregnant, but can the patient retain the ability to get pregnant and still go through the nose? And they're like, okay, yeah, looks like there is a pathway. We're going to go through the nose. We're going to encounter these bones on the way. We're going to drill out those bones, and the blood vessels are closer on the right side. So we're going to focus on the left, and we're going to drill into the left side, and then we're going to see the tumor right away. We're going to pop right into tumor. We're not going to pop into brain first, where if you went through here, you'd have to move brain out of the way. Just knowing what you're going to encounter first is important to think about. And then after you get the tumor out, it looks like there's some that has grown to the side. So once we get that out, I have to remember when I'm in the surgery, there might be a hidden pocket off to the side of tumor. So then we're going to reach out there, pull it out. And then you got to think about when we close through the nose, you don't want to leak spinal fluid from your brain. So I'm going to plan on positioning the patient like this with their abdomen open. I'm going to cut open just the skin of their abdomen and take out some fat. I'm going to pack some fat up there so that it doesn't leak fluid from the brain. So you're planning multiple stages. And then you're thinking after surgery, if they have a leak, we'll have to put a drain in their back to drain fluid off. So we're going to put them in the ICU.
So you have to have like backup plan after backup plan.
Exactly.
Wow. Yeah. Man, you got to know your stuff about the body, man. Like you got to know all of the nerves, all of the things behind the eyes. Like dude, don't ask me what all those are.
Everyone has their own special. That's what makes the world go round. Is like, you're specialized in an area that I would have no experience in. And that's for me, that's why this training is 7 years. Like, you don't want someone operating on your brain who isn't comfortable making those decisions. And you get that comfortable after 7 years.
Looking back on like little Forrest in high school, let's think back to that time for a minute. Tell me some things. Oh, and this, by the way, this section I'm going to call note to self. Yeah. So tell me a little bit about what advice you would give to younger you. Would you do the same things? Would you do some things differently? What would you say to yourself as far as your career goes?
I would say that the first thing that comes to mind, it's an easy one, and that was just to like stop stressing about everything so much. I wish that I would have just like lived in peace with my life a little bit more, rather than, because I would work super hard. Like I would be paying for my college myself, and so working a job, trying to shadow doctors and trying to volunteer, like at a hospital, or volunteer in multiple different locations, and then trying to get straight A's in school. And then I would do all of that. I would do it, have a successful day. And at the end of the day, I'm like, did I do enough? What else should I be doing? Instead of just being like, I'm on the path, I'm doing as best as I can. No more stress. Stop stressing about what I can't control. Like, will the people looking at my medical school application, will they like what I've done? You can't control that. Like, after it's out of your hands, stop stressing about it. And I always felt that because I grew up poor and I didn't really have a lot of guidance on how to get into medical school, I was constantly comparing myself to my peers. And I was always self-conscious that they were better prepared than me and that they were smarter than me or somehow like doing the right things and I was somehow lost or not doing enough. And it made me distance myself from those people. I didn't want to be near them because knowing what they were doing made me feel like I was not doing enough. And that was not beneficial for me. It was more stress, maybe fewer friendships with people who could have helped me along the way. And it turned out in the end that what I was doing, which wasn't necessarily exactly cookie cutter, is better. It's better not to be cookie cutter. It's better to focus on things that you're actually passionate about than trying to fit into a box. And then number two, stop with the imposter syndrome. I think a lot of people have imposter syndrome. I don't know if everyone does, but I think most normal people have imposter syndrome. And if everyone has imposter syndrome, no one should have it. And
Hmm.
because all of us think that maybe someone is better than I am. Maybe someone is more prepared than I am. That does not matter. Everyone has different strengths. So that would be the other way to distill it down in one sentence. It's just like, stop comparing yourself to other people and trust that you bring value to the table.
What I gleaned from what you were saying is that don't be afraid to get to know people who you may feel are more well-rounded or like better suited for a position. Like even though they could be um even though it could be intimidating to get to know them, still do, because that they can teach you so much, and maybe there's something that you could teach them.
Yeah, and don't assume that they're better than you. They're probably, you're both probably looking for expertise where both of you can contribute.
Cool. I love that. So for people who are, just barely entering the job market, maybe not even the job market yet, they're just graduating high school or something. What would you tell them if they're even slightly interested in the medical field?
Yeah, the first thing you should do is to shadow a doctor, multiple different specialties. I never thought I would do neurosurgery. I was shadowing like, hospitalists and I was shadowing ophthalmologists. I tried to find a neurologist and the office that I called was like, oh, we don't have any neurologists. We just have a neurosurgeon that would let you shadow. And immediately I was like, I'm never going to do that. But I do need exposure to the medical field. So I went and shadowed and immediately the first day fell in love with it. And that was in college. And I stuck with neurosurgery throughout that whole time.
So wait, hold on though. So you didn't even know that you wanted to be a neurosurgeon. You just knew that
No,
you
I,
wanted the medical field, something.
yeah. So initially I thought I was going to be a addiction recovery counselor. That's what I wanted to do. And then I sunk so many hours into trying to help people. And I felt like I made zero difference. And I thought, okay, there's got to be something like in the medical field that actually like lets me make a difference. And so I tried to shadow like non-surgical specialties. And then someone said, yeah, we have a neurosurgeon. And I was like, yeah, there's no way. I'm not going to do neurosurgery. Like that's ridiculous. And then I shadowed him and I was like, this is incredible. Some guy came in, not able to provide for his family for like weeks because of he had a herniated disc in his back. He couldn't walk, couldn't do anything, couldn't provide for his family. And we did a surgery that removed that disc. And the next day he was up and walking, able to provide for his family, which is like almost crying in relief. And I was like, okay, so this is the opposite of no shame to people who do addiction recovery. Thank you for your service because I cannot do it. I cannot. But I was like, this is the exact opposite. We did a 1 hour surgery with my hands. No, I didn't do it, but the surgeon did it with his hands. The next day he's back to work. His life has changed. That is what I want to do. And that's how I
Yeah,
got
just
into
like
the field.
such a night and day difference in one
Yeah.
sitting.
Yeah.
Wow.
Exactly.
Yeah, that is really cool. And isn't it wild how that happens though? Like you go and you actually experience something and then
Hmm.
realize, wow, actually this is for me. I didn't think it
Totally.
was, but it is.
You've got
And
to get exposure somehow. Yep.
so how does someone do that though? Did you just like cold call offices?
Yeah. Yeah. A lot of people will be surprised to find that their parents or someone else that they know has a connection to a doctor. So asking your network and just say, hey, do you know any doctors? And it's like, oh yeah, we have a friend. Okay, let me shadow them. And then through that doctor, you could find another specialist because they have other doctor friends. And so I was cold calling, but I should have used my network because there were definitely people in my network in hindsight that would have allowed me to shadow, but I was just cold calling, cold emailing. But what I did, and to be specific, if anyone's listening to this who actually wants to do medicine, I would call, ask for the office manager or the office manager. And I would say, hey, what doctors do you have that would be willing to let me shadow? And you might go through like 3 to 5 offices of no answers or nobody willing, and then you'll find someone. So that's how I did it. And it was fortuitous that I shadowed the neurosurgeon and that's how I found my field.
Was he the first one that you shadowed then?
He was the first neurosurgeon I shadowed. That was the first surgery I saw, and I immediately was like, "Oh yeah, this is it."
Wow.
I had shadowed other doctors though, and I was like, "Okay, this looks like a job." No offense to those
Huh.
other doctors.
No,
I
yeah,
love that they
yeah.
love it. But I was like, "This looks like a job. That sounds fine. I'm happy to do this job. It sounds great." But neurosurgery was like lit a fire under me. I was like, "I am for sure. I would love this if I could do it."
That's amazing. You found your passion just by shadowing someone you didn't think you'd ever want to be like, right?
Exactly, exactly. It is amazing. It happens probably all the time. You don't have to do it every week, but just every once in a while, shadow someone with a different job, an accountant and a person who's in advertising and business, and just see what things about each job you like the most.
I love that. That's awesome advice. Okay, so this last little bit I called your future commute. So here you are in your fourth year of residency and you're looking at the future. You have 3 more years. What are your goals from here? What's your ambition? What are you looking for in your career? Or like, what will get you to your dream life outside of your career?
I think that the next phase that's in front of me is wrapping up my residency, and what I'm going to do is treat every single day and every single patient, every single second like it's preparing me for my future and give it my all, because you only have 7 years. I mean, it sounds like it's a long time, but you only have 7 years to maximize your training experience and become the best you could be. So I'm going to do that first and foremost. I'm going to look for a job in a place where my family's happy, because one thing that a lot of people do, if they're the stereotypical breadwinner, is they think about their career as like the most important thing. But think about the other lives in your family. Maybe you don't have a family yet, but when you have a family, for me, I have 4 other lives that matter just as much as mine. Their happiness matters just as much as mine. And so if we can live in a place that makes them happy, then I can make that happen. You know what I mean? Like if it means I take a little bit of a pay cut or work a little bit more or whatever, I still love my job. No matter where I go, I know I'm going to love what I do, if it's mostly operating at least. And so that's my goal, is basically to make them happy. I'm going to focus on a geographic location that'll make them happy. For me, it's going to be like Utah, California, Arizona, somewhere west. And unless they want to go somewhere else, I'll follow them wherever they feel like they'll be happiest. But that's where we think we'll want to go. And I'll hopefully find a general neurosurgery practice. I'm open to an academic job as well, like to being a teaching neurosurgeon to help residents and things like that. But I would say it's just more statistically common for me to be a general neurosurgeon doing some brain and a lot of spine surgery. So that's my goal. And I think that the way to get there is just do my very best every single day in residency and um, treat it like it's all geared toward helping patients one day.
That's really inspiring, man. Like I think that it's really great to see the positivity for your job and the outlook you have on what it will do for you and your family. That's really important, I think. And I think it's important for people listening too to be able to hear that if this is something that they're wanting to do, it can give them that flexibility um to provide the necessities for themselves, for their families, for the people in their lives. Do you feel like the journey is the same across the board for people in the industry?
No, it is definitely not. It is not the same at all. Like, depending on where you choose to do your neurosurgery training, and you don't have a lot of choice, to be honest. I mean, because you pick what programs you want to go to, the programs pick what medical students they want, and a machine algorithm matches you up. So you don't really get to pick where you do your training, but it's dramatically different depending on where you train. I will say that I love my job and I love where I train, but I'm sure that I'd have maybe some challenges that I don't have now if I train somewhere else. That's a good question that you've asked, because it's dramatically different depending on where you train. And even your job, the job that you take could be dramatically different depending on where you live and what job you take. So, and you have to make a lot of sacrifices to get here. So you better really, really love neurosurgery, because it could hurt everything in your life if you don't love it enough to stick with it when the going gets tough.
That's awesome. Yeah, great advice, man. Is there anything else you want to share just to any of the listeners who are wondering about it? Anything that you want to share about your own journey, getting where you are now, or the journey to come?
The thing that I would say is that your ability to love what you do is a choice. Same thing with relationships, same thing with everything in life. So if you really want to do something, you can commit to it and you can choose to love it. I mean, there's some things that are just objectively terrible, right? That's obvious. There's really hard parts about neurosurgery. Despite how much I love it, it's extremely demanding. It's extremely heart-wrenching at times and it's extremely discouraging at times. That's natural, right? But I love it so much and I continue to love it so much because I've made the choice and I'm sticking with the choice. So if you're going to go into medicine, do not do it half-heartedly. Do not do it because you're going to make a lot of money because you will absolutely regret your decision if you think that you want to go into it because you're going to make a good living. You can find other jobs that will give you more free time, less emotional challenges, less burden on your life that makes you just as much money or a good enough amount of money or a good salary or more money. So do not go into this because you think you just want to make a good living. I think that people that they compensate physicians the way that they, because of the sacrifices that go into it, because of the skill that's required to go into an event. But I think if you asked a lot of physicians and a lot of surgeons if they regret their decision, if they would choose medicine again for the money, no, I don't think any single person would say it is worth it because of the money. No, you have to love it because you love people. You have to love it because you love medicine and the puzzle and the challenge. And the money just makes it tolerable for the bad parts of it. So this is a job podcast. Otherwise, I wouldn't be talking about money in general.
Yeah,
But
absolutely. Yeah.
you better love it before you choose it.
And I think that goes for a lot of jobs too, is that
Yeah.
it, it does take a lot of investment and a lot of time to switch career paths. So yeah, it's it's
Love it
it's
up for
really
you better
great
love
if
it.
you can. Yeah, it's really great when you can find your passion early.
That's exactly right.
And that's okay if someone doesn't, but it's really great if anyone can find their passion at all. But the earlier the better, because the more you can do something that you love.
And it seems like that's the point of the podcast, right? Find something that you love early on, and then you'll be live a much happier life in every aspect of your life.
Yeah, absolutely. So, yeah, thank you so much for being on today, Forrest. It's been awesome to have you. You've shared so many helpful insights and given our listeners so much to think about and consider. And I'm hoping that eventually, like, once you've gone a little further in your career, I want to hear back. We'll have you back
Yeah,
on, and it'll be cool to see the evolution.
absolutely. Yeah, I'm excited as well.
Awesome. Well, yeah, thanks again, and we'll see you next time.